So we're on our third panel, and this is on approaches to promote healthy development during the prenatal and early childhood phases. And we're very excited to have the four of you with us today. First, we'll hear from Jessica Pizarek, a senior associate with PolicyLink. Second, we have Elena Sabala, program director with South Bay Community Services. Third, we have Dr. Ann Mauricio, associate research professor and an implementation scientist at the Arizona State University Reach Institute. And we have Dr. Elisa Nichols, CEO and pediatrician at the Children's Clinic, serving children and families in Long Beach, California. So thank you very much, and you can just go ahead and dive in, and each of you can speak, and then we'll have questions and answers at the end.
Well, good morning. My name is Jess Pizarek. Again, it's nice to meet you all. Thanks for having us. I just wanted to take a moment to just express gratitude for the intentionality of how this panel has been designed, the mix of evidence-based research, but also really an honoring of wisdom and community voice coming up as well. So just wanted to say thank you for that. So quickly, I represent PolicyLink and the Promised Neighborhoods Institute. At PolicyLink, PolicyLink is a research and action institute located in Oakland. We're a national nonprofit, but we really do focus on lifting up the voice, wisdom, and experience of community around racial and economic equity into legislative efforts and then back again into implementation. I also represent a variety of partners who have been supportive of the Promised Neighborhoods program launched by the U.S. Department of Education over the last 10 years. And so I'm honored to be able to speak in partnership with them today and on behalf of their experiences as well. So I'll just give a really quick overview of Promised Neighborhoods for those who are not as familiar, just a quick little insight into who the Institute is, and then really kind of dive into some of the more nuanced information about what we've learned and continue to learn through the Promised Neighborhoods demonstration project. Talk a little bit about early development that's being utilized and what early outcomes we're seeing within a variety of Promised Neighborhoods throughout the country. And then really some considerations for funding, scaling, sustaining those efforts, regardless of whether communities are federal grantees or not. And then finally, just a few broad lessons learned that we are grappling with and will continue to really look into as the movement grows. So quickly, in 2008, the Obama administration expressed a desire to launch a series, a suite really of place-based programs that would look at inequities from cradle to career. And in 2008, the department approached the Harlem Children's Zone, the Center for the Study of Social Policy, and PolicyLink to really explore whether or not the Harlem Children's Zone model could be replicated in communities across the country, not just as a way of building out new programs to meet the needs of students of color and low-income students, but to really think about how we build out fully serviceable pipelines across from early childhood, prenatal, all the way through to college and career readiness. So as communities are doing this, we're thinking about early implementation, full implementation, reaching scale, and then finally sustaining those results. So as we know from the Harlem Children's Zone, this is a multi-generational effort. So HCZ has been around and demonstrating results for over 20 years. The Promised Neighborhoods program was launched in 2008, but funding really started in 2010. So we're really only 8 years into the demonstration of the project. This effort is really grounded in racial and social equity. So in about 70 communities across the country, local leaders have banded together to understand really what are the most pressing issues at play within each of their communities, unified by a common framework, which we'll talk a little bit about in a moment, but are thinking about how to not just, again, build strong pipelines of program delivery to students and their families, but to really think about how we can build these out for the long term. So looking at issues around organizational and strategic capacity, data use, strategic and accountable partnerships, the ways in which communities engage, but more importantly, govern these processes, sustainable financing, which has been touched on quite a bit today, and hopefully we'll be able to talk through a little bit more, the way in which policies and systems influence can go ahead and shore up these initiatives, and then finally, how you communicate these efforts and effective framing. So the Promised Neighborhoods program was built to achieve population-level results, which we consider to be a 60% shift as our tipping point. And all communities who are engaging in a Promised Neighborhoods initiative are really aligning their efforts around 10 results and 15 indicators across the cradle-to-career spectrum. Embedded in the Promised Neighborhoods approach is that we not just collect data for the sake of understanding how population trend lines are shifting, but that we engage in a continuous improvement process. So really what this looks like, both from the conception of a Promised Neighborhood initiative all the way through those 5 stages that I showed in the developmental pathway, is really going through this continuous improvement process, which starts with understanding, sense-making, really what's going on with our community, and not just by a group of leaders who are at a table, but really in partnership with community. So taking, again, that population-level accountability mindset, really being clear about who is being served within a universal approach. So again, that targeted universalism approach, understanding that racial and economic equity are at the core of an initiative, and then using the 10 results and 15 indicators with us, appropriate baselines to understand what's been going on, really interrogating into that data to understand what are the targeted factors that have created the disparities that we see for our kids and families. And then having had deference for really an honest conversation about what has been impacting kids and families, then talking about strategy development. So not jumping to what we've been doing, not jumping to what we think could look could look good to funders, right? Not thinking about what could look good to folks in the community who may have more power, but really talking about what's going to be a targeted strategy for the children and family who we serve. So some of that is evidence-based practice, and so thank you to those of you, many in the room actually, who have provided that kind of strong evidence for us to make this argument and to put into practice. And then also really leveraging the professional and cultural knowledge of the local leaders who staff up Promised Neighborhoods, who govern their processes. Central to this is a strong data system, which we'll talk about in just a moment. But that data system allows for a Promised Neighborhood coalition to go ahead and walk through these steps on a continuous basis. It also allows folks to really get into aligned contribution. So Promised Neighborhoods is not built upon the premise that you build new programs. It's really built upon the premise that you highly align and then actionize collective impact amongst stakeholders. So it means that families are not only involved, they're not only engaged, but they're governing the process. It means that good programs that are already being used are scaled up. And then it means that system and policies are really diagnosed, so engaging in long-term systems change and critically in policy change. I think those of us who have been involved in community-based work for a while can understand that to do this is a long-term goal, right? So you don't just do this once, you don't just plan once, you don't just assess once, you do this on a continuous rotation. And so Promised Neighborhoods are currently 8 years into what we know is a 20-year journey at the very minimum. And so they're walking through this aligned process on a regular basis. And Elena will talk a little bit more, I think, about what that looks like on the ground, but just to know that this is a framework that has been used across the country to really get at critical results. So part of that, and critical to this, is the use of highly disaggregated localized data. So we talk about getting at population level results within a targeted neighborhood, but there are equity implications in the data that we use. So I'm sure many of us who are present in the room understand that the data that's available to us through large public sector data banks are not always representative of the kids and families who are actually shaping our strategies around. So critical to the Promised Neighborhoods approach is building out a healthy living case management system. So every Promised Neighborhood, hopefully a little bit more robust if they have federal implementation funding, is leveraging really the interconnectedness of their partners in those highly aligned strategies to be collecting individualized data for every student, every family member who comes through their doors. And in the process, the hope is building out a longitudinal data system that allows us to see not only correlation amongst dosage of programs, but to hopefully get a little bit closer to what we can talk about in terms of causation, and especially that long-term, highly coordinated effect across the pipeline. This is just a snapshot of a tool that we have used. So the Promised Neighborhoods Institute, again, was founded in 2008 to help guide and shepherd the project. We worked directly with the Department of Education to launch the program, and as part of that, we played a backbone role in building out some of the common tools for that data infrastructure to go ahead and kind of ease some of the pressure and the demands on local leaders. There's already been a conversation today about how expensive data is, and I can't underscore that enough, that if we really want to talk about highly localized, equitable data collection, there's a dollar sign behind that. This is the Promise Scorecard. This is just a snapshot of an example. So again, the 10 results in 15 indicators framework. This Promise neighborhood, who should remain anonymous, was looking at making sure that children are ready to learn, looking at their baseline around how many kindergartners actually demonstrate at the beginning of the program that they are age-appropriate functioning. And then what a site can do is go ahead and really factor into this and look at not just their baseline, but also their targets. So understanding that it takes time to get at population level shifts, but what are some ways in which we can hold ourselves and our partners accountable on a yearly basis to understand what dosage and what strategies are actually being effective. So just a few examples of some of the early learning practices that are being used in Promise neighborhoods. And again, these are not exhaustive to any extent, but really looking at common assessment, including agents and stages, and again, ACEs. Looking at home visiting programs in coordination with existing public resources, like a Head Start. Again, utilizing case management to ensure that kids and families are not only getting that high quality program, but they're also being connected to others outside of what we traditionally think of as academic partners, so community health care providers. And then finally, really leveraging the existing data infrastructure that we have at our disposal. So again, this is dependent upon what state a Promise neighborhood find themselves in, but if they are in a state with a quality rating system, it's incredibly helpful. Just a few results. These are not exhaustive, but you can see that many of the Promise neighborhoods that we work with, these are all implementation sites, are already starting to show pretty respectable outcomes. Again, these are small population sizes, so I believe Dr. Duncan said that we have to kind of rein in our expectations. So again, these are small population level sizes, but the intention of the Promise Neighborhoods federal program was to demonstrate that if you took a neighborhood, if you took a geographic footprint, and you really started to get at scope and scale, how that infrastructure could then bleed out throughout a city, throughout a county, depending upon where you find yourself in the country. So a little bit about money. Promise Neighborhoods is typically referenced as a highly capitalized federal investment, and it indeed is. We have had 6 classes of grantees, ranging from those who receive planning grants to implementation grants, and finally a new cohort of continuation grantees who are communities who have planned their Promise Neighborhoods, who have gone through the implementation cycle and now are receiving additional funding from the Department of Education to continue for 2 more years. That's looked up to a tune of $565 million across nearly 70 communities over those 8 years. And this really has been only possible because of bipartisan congressional support. So I mentioned that when a site is going through diagnosing what the best mix of its solutions could look like, so family engagement and governance, looking at programming, looking at policy and systems change, inherent in the Promise Neighborhoods model has been an expectation that sites do have to be engaged in political advocacy because we know that federal funding is not guaranteed. So we have been lucky enough that Promise Neighborhoods funding has stayed level since 2010, meaning that any site who received funding continued to get it through its award cycle, but that it has not been guaranteed that there would be new cohorts every year. So we had a break between 2012 and 2016 when there were no more communities being awarded. And that had huge disruptive implications for the model and for demonstrating the efficacy of the model. So when we have conversations about just how critical it is to not only present the work and data to legislators, but to do so effectively and to do so in a way that builds empathy has been underscored in Promise Neighborhoods. The only reason we were able to get continued funding is because communities invested in sending residents to Washington on a regular basis to advocate and use their voice to underscore the efficacy of the model. We are elated to share that Promise Neighborhoods was included in the reauthorization of ESEA, which is the Every Student Succeeds Act of 2015. So the program is safe for the next foreseeable future until the legislation comes back up for reauthorization. Again, though, funding is dependent upon allocation, and so it is a political fight every single year. I cannot underscore how important our bipartisan congressional support has been. But it's not enough. So in addition to federal investments and then also private funding that sites rely on and go ahead and braid, they're also looking at state advocacy as well as local advocacy. So many sites in states such as Minnesota, Utah, Florida are looking at leveraging the federal investment to then talk with their legislatures about expanding funding for cradle-to-career initiatives within the state, regardless of whether or not communities are federal grantees. And then finally, this is a little bit of a new area for us, but we're also looking into braiding dedicated funding streams. So I'm sure most folks in the room are aware of San Francisco's Department of Children, Youth, and Families, which is a dedicated funding stream through the city and county. The city of Oakland is looking at a parcel tax, which would be dedicated funding for their cradle-to-career initiative. And then finally, cities like San Antonio who are leveraging their pre-K initiatives to go ahead and support their Promised Neighborhoods work. Finally, just a few considerations that we've learned working in partnership with children and their families in this process. Excuse me. So this model was built off of the Harlem Children's Zone. It was built off of a formula that had been proven to work in Harlem. And it has had to remain flexible depending upon the number of communities who have adopted it in various geographies. So when we talk about a model, when we talk about the application of science within a model, we have to be clear that what works in an urban setting may not work in a suburban setting, may not work in a rural setting, and especially may not work in an indigenous setting. Communities will face unique challenges, and fundraising is central to this. So while a huge investment of federal money is helpful, it is not sustainable. And communities who are looking at the edge of their funding cycle are reliant upon the funding community that is local to them. And if you are residing in a rural or a tribal community, your options are significantly limited compared to those sites who are in urban communities. And so from a long-term planning perspective, and especially the efficacy of seeing long-term outcomes for our kids and families, financing has to be at the forefront of how we're planning. Again, strategic advocacy, leveraging the results framework, right? Leveraging the local data is key to securing that blended funding. And then finally, what we've learned, and I think Elena will speak to more eloquently, is that you cannot just invest in programs. And you cannot just invest in existing providers. We have to invest in a flexible way and in multi-year installments into community members who understand how to deploy programs. I think what we have found is, and which has been amplified to us, is that it is just as important who is deploying the science as what science is being introduced. So on that note, I'll pass it over, but just key, we're hearing conversations about the back and forth between science and legislators, and I would like to remind us that the back and forth with community is just as key in this process. So, thank you.